Welcome to True Out Tuesday, and the truth will set you free. The truth. Now, today we're going to talk about one type of bowel disorder. Next week, we'll probably cover Crohn's, ulcerative colitis, inflammatory bowel diseases. Right now, it's diverticulitis. But has anyone seen the different changes that's occurring? Yeah. We're going to open the bars. No, we're going to close the bars. We're going to open the beaches. No, we're going to close the beaches. Okay. So if you're frustrated, if you feel like there's an evil force, okay, that something is overtaking not just our government, but our lives. And when you look at this, millions of people are going to be out of work and their lives are devastated from the economic or the government response to an infectious agent. It's literally wiping out a lot of the lives. And if you're thinking there's some kind of evil force behind it, understand that dark can't exist without light, light can't exist without dark. So even though you're hearing this on CNN and from most of the politicians, just be scared, be scared, be scared, be scared. The opposite, the antithesis is there. So just know that when the crap hits the fan and you feel like there's like what President Lincoln said, and this guy had a huge amount of stressors. Anybody want to go through, trying to hold the country together? Okay. He said he was driven to his knees because he had nowhere else to go. Okay, so I put the yin and yang symbol up there to know that even though things are so friggin' crazy now, particularly if you're a waitress or a chef or a business owner that is deemed non-essential. Yeah, how'd you like to be a waitress, have 3 kids, and be told you're non-essential? Okay. So, diverticulitis. Now, stressors. This is one of the good and evil things, because we're going to go through a couple of things that's going on now. Like, when I look at a beach scene like this, I'm thinking, cool. People have broken down the fear and they're enjoying life. Because when you see somebody with a mask, and I see people like this a lot, generally not in the office because we've educated people and we've talked about it. But if they're wearing a mask, ask them. Say, what would it take for you to feel safe and secure to walk around without it? Good question. I think it's a good question. You're going to get a confused look, though. It's like, what do you mean? Okay, do you think that our government, Newsom, or the other psychotic governors are going to say, we have just found out it is now in control and you can take your masks off and hug each other? Anyone think that the government is going to just throw away all this built up fear? No, the fear is too valuable. Because, I think it was Jefferson, if you give up freedom for security, you're going to have neither. Well, this was really interesting because I see lack of masks as somebody understanding that you're designed to live on the planet. There are certain risks with life. Like, I can cross the street and I could get hit by a bus. If I look both ways, I might be okay. But I'm going to decide whether I should cross the street or not. Does that make sense? So I understand that there's viruses, funguses, bacteria, and smelly people, and I'm willing to take that risk to smell their bleh, okay? But look at this. The people that are wearing masks and social distancing are the ones that are trying to open up the economy. You're just selfish. Wow. I'm reading this and I'm going, you're kidding. Somebody's brain thinks that? Okay, hi, we're going to wear a mask all the time. You can't see my facial expressions and I'm going to be serving you. Okay, I would be sticking my tongue out underneath that mask. I guess civic responsibility is just too damn hard to accept, but I bet if any of these people get sick, they'll want others to risk their lives to take care of them. How utterly selfish. And I'm looking at this and I'm going, how could you come up with this? But this is how other people's minds are working. Because if you were going to watch CNN, and I found this out too, this past weekend, I met a couple of people totally into CNN, totally into the conspiracy that our government is protecting us and that this virus is going to kill everyone. That they've never seen anything, never seen any facts. Great. Now our numbers for COVID will jump right back up as a result of these people who have no care of putting others at risk. So if you use a mask exemption, which is legal in California, and you have these evil looks, okay, that's what they're thinking. Here's a note to the censors. Hopefully this one will bypass them. These are the references that we are using in this talk. New England Journal of Medicine, Food and Drug Administration, National Academy of Sciences, and just pretty much nothing but peer-reviewed journal articles. So this is the new normal. Okay, just want to make you sure that understand that this wasn't just a rise in cases, because guess what? And I'm glad you're sitting down. They're doing more testing. So will that make the cases go down or go up? Okay, I know I'm going too fast. Just settle down. Cases are rising. Yeah, we're testing millions. It should be because it's a virus. If you tested for the flu, they'd still be doing that. So now you're going to have businesses open, then close. And we were driving down the street the other day, Belmont Shores, beautiful area. And all these restaurants are taking up the parking spaces in front. They're building separate walls to have them outside, just doing everything they can to bend over backwards to comply with the psychosis. And now, nope, you can't have outside dining. Nope, gone. Beaches were open, now they're closed. If you're in LA, except some of them are open for activity, but you can't lay down a towel. See, if you lay down a towel on sand, that makes you infectious. What's needed to go back to normal? Mandatory vaccines. So you give up your bodily integrity for the rest of your life. Contact tracing. This means that if you don't need a warrant to search a home, somebody of these guys can come right into your home to check you. And they're not going to check you. They're going to look at your cell phone and everybody you've been in contact with. And anybody you come in contact with, they can quarantine. So that means they can take them out of anywhere. So, I mean, I got to tell you, you see people in China and Russia going, God, I wish we thought of that. Okay. Now, you're going to see a lot of articles like this coming out over the next few months and few years, because what is the CNN teaching people to respond? Because they're not really educating, and they're just giving you short bullet points that have no basis in fact. One of them is Sweden has a high death rate. Really? Do they? Okay, do they in comparison? How are they gauging the death rates from COVID and the death rates from the economic disaster that other countries are doing? It will only be actual found out in the long term. So when we're talking 5 years from now, okay, if they have a good industry, if they have a good healthy population, everything else, the COVID deaths are going to be a very small percentage of it, possibly. But right now, it's foolish to say this country did good, this country did bad. But what we can do, we can look at other countries around the world to say, wow, none of their kids are in school wearing masks. Wow, it looks like all the tracing that they have done shows that kids don't really transfer this to adults. Just little things. But this article is really cool, July 1st, published a couple of weeks ago, out of the Journal of the American Medical Association. So since our entire economy is crashed completely, it will never recover, at least not for the next 5-6 years, okay, wouldn't you think that there would be, a doubling, tripling, quadrupling of the death rates, to make this justified? Or if you're listening to the bullet points on CNN, well, it's only because of the lockdown. Otherwise, there would have been 2 million deaths. Well, let's look at human beings in, this date. It's July 14th. Every day in America, when you get a country around 330 million, 7,700 people die every day. That means yesterday, about 7,700 people died every day. The day before, Sunday, Saturday, Monday. So every day, about 7,700 people are going to die. from gunshot stabbing, heart attacks, diabetes, falling off a roof, shot by a jealous husband. So all of those things. Now, I'm kidding about the jealous husband, so don't, that's not a big category. But you look at this, what does shutting down the economy do? What does locking people in their homes do? What does the social isolation do to other disease rates? Wow. Okay, so this says from March 1st to April 25th, they had a total of 505,000 deaths. That's around 87,000 were excess deaths. So when you're looking at 500,000 deaths, and they said 87,000 seemed like it was too many. However, out of that 87,000, about 56,000 were attributed to the COVID-19. Now, when we did a couple of our videos that were deleted, censored, and brought up on charges just about, because the censorship has gone through the roof. There's a lot of organizations that I used to post on Facebook, and I don't know if you've tried this yet, but when you start to post other things, they say, no, we're not going to post it. Okay, I know it's unique. It's unique. You know, I'm kind of identifying with North Koreans now. So when you look at this, 5 states with the most COVID deaths experienced large proportional increases in deaths from non-respiratory causes. Diabetes, 96% increase. Heart disease, 89%. Alzheimer's, 64%. Cerebral vascular disease, 35%. Now, New York is different, though. They had a 398% increase in heart attack deaths. They had a 356% increase in diabetes deaths. I know you're thinking they're locked in home with their social isolation. They should be healthy. Wow. So when you look at it overall, and this is only if you're taking the March to April, the total deaths from, and remember, COVID, it's not that you died from it, okay? You died with a positive test or a suspected positive test. It doesn't even have to be suspected. So, but let's just take their numbers. You're looking at around 13% of the extra deaths. That's it. Suicide versus coronavirus. Now, this states that unemployment rate is increasing. Suicides rate increase accordingly. They do. And they're saying about, 1% increase in unemployment. And what is it? It's around 40% now. Okay, 1% increase in employment in a population of 330 million will lead to about 69,300 suicides every year. And 12 percentage points lead to around 831,000 suicides from the economic disaster caused by the government's intervention or protection of you because you're not adult enough to wash your hands or take vitamin C or look at the actual statistics and find out that you're looking at 99% of every people that died was over 70 with a comorbid condition. And you probably think, oh my gosh, you're a healthy 60-year-old. You don't take any drugs. You could probably bike ride on the beach without any problem. Yeah, I was thinking that. And what happened to me? I got sunburned. Okay, so that's all we're going to talk about on that. But we're going to go over in a little bit more detail because we're going to see some really cool articles and some that are actually full of common sense. This is interesting, though. In the last 6 months, I've gotten more and more patients, and I'm talking kid patients with tumors. A few weeks ago, a teenage girl, nasty sarcoma in her leg. This one, 4-year-old kid's got a sarcoma or a benign tumor in his arm. And this one, 24-year-old gal with a benign tumor on her scapula. Now, where are these tumors coming from? Because it's unusual to find it. Now, I was working on this guy, and he's really, really famous, okay? And I research a lot, okay, a lot. This guy researches more than me. And so I'm talking to him, asking him about, because I know that vaccines are associated with some tumors, and he tells me about cat tumors, that cats are developing so many tumors from the vaccines that they're vaccinating inside of tails, because if the tail develops a tumor, it's easy to have a a tailless cat than a legless cat. So I think I've never heard of that. So I looked it up and I thought it was, well, because, we have this warp speed vaccine that's been tested on 45 people, and half of the time, and don't worry about it, they watched them for days. Okay, now this, okay, it's going to be approved for 330 million people. Not approved, it's going to be required. Okay, so they have a next round. Now, they're not going to follow them for months or years to find out if there's tumor growth. So I just thought I'd share this with you. Reports of a cancerous mass rising from bone or cartilage developing at the site of vaccine injection sites in some animals had led to the suspicious link between a vaccine and deposition in some animals of this type of reaction. Cats may develop a specific site sarcoma following rabies vaccination or feline leukemia vaccination. These tumors are highly invasive, rapidly growing, malignant, blah, blah, blah. Okay. The cause for the development of the sarcoma is unknown. So, since our cats are in danger, got a task force. 1996, the Vaccine-Associated Feline Task Force. Now, I like cats. I had a cat as a pet when I was a kid. So I don't want you to think my sarcasm doesn't appreciate cats. Okay, it's just a third of my practice is under 12, and I see a tremendous amount of vaccine-damaged kids. Tremendous amount. And we're talking, even the CDC says it's 1 in 45 now with autism, but it's 54% of a chronic illness or injury. So I know the kids are being damaged, and it's got to be some environmental cause, because genetics don't change that rapidly. But I thought this was interesting, because in 1996, they developed a task force was formed with missions to propose changes in vaccination protocol to reduce the risk of the feline sarcomas. In 1998, the American Association of Feline Practitioners developed a feline vaccine advisory panel to develop recommendations for appropriate vaccinations based on individual risk assessment. I'm glad. A few people just said, wow. No, this is wow! You mean one size doesn't fit all? That you should look at the individual and say, you are different than you. Although I love you both. Yeah, they're finding out that cats can't have the one size fits all, that the 72 doses of 17 different vaccines for every American child by the time they're 18, that there's an individuality. Luckily, the government took that away from the medical doctors, so they can't even say no. Risk variables to consider when formulating an individual cat's vaccination protocol include age, lifestyle, environment, and cats should only be vaccinated as often as necessary to maintain protection against infectious agents, which they have a real risk of exposure. So does that mean that the cat should get the hepatitis B because they're IV drug using and sexually active at 12 hours old? No, humans got that. Okay, so I just thought that was interesting, So now let's get into the diverticulitis. Digestion begins in your nose. Now we have a budding astrophysicist who was asking me, why doesn't the stomach digest itself? We won't go into that. Okay, but that was a cool discussion. Okay, so you take something in your mouth. It goes down the esophagus into the stomach. The stomach breaks it down. Carbohydrate digestion begins in here. Protein digestion begins in here. Fat digestion gets right out of the stomach. It gets into the duodenum area, this little circle thing. Now the pancreas drains into the duodenum and the common bile duct drains in there. So your fats hit that duodenum, man, they break down like crazy because the bile stores and concentrates it. So this is actually a brilliant system. It's designed to initiate digestion, and it keeps you alive. The only reason that you are alive is because you're able to break proteins to amino acids, fats to fatty acids, and carbohydrates to usable sugars. When we're talking the immune system, 80% of your immune system is in that gut. Oh, so if we have an immune system challenge with our population, and let's call it a virus, should we look at people's guts and immune system to elevate it? That would be a plus. Now, we also have the sympathetic and parasympathetic nervous system. One part keeps you alive under stress. That's the sympathetic. It's located in the middle of the back. If I drop a brick on your foot, your fight or flight will go up. The other part is rest, digest, and repair. Now, that's located in the neck and the pelvis area. So if you've had a neck trauma, okay, that might not be functioning correctly. Okay, and that's resting, digesting, or repairing. Now, if you're in a fight or flight state, like let's say you just watched CNN, or you saw that they're individualizing cat vaccines, but not adult vaccines. And that might piss you off, okay? Even though we all love cats. So what is this? Because we're in a stress state. We're in that constant sympathetic dominant state, which is going to shut blood supply down. Now, inflammatory bowel diseases, we're going to cover more ulcerative colitis and Crohn's, because ulcerative colitis, I got a soft spot in my heart. When I met my wife, she had ulcerative colitis, and we're talking 20 years. And when you're looking at what they do for this, so what decreases nerve supply to the gut? A sympathetic dominant state. What increases it? A parasympathetic state. So we're looking at an autonomic balance that controls it. Should we look at that first, or should we look at that first? Okay, I'm just trying to get some opinions here. Okay, because if you got a sympathetic dominant state, you got altered nerve supply and blood supply to the gut, it's foolish to try and do any drugs or therapy or diet or anything else, because that person has slow gastric motility. It's not going to work. Does that make sense? So you got to look for the autonomic dysfunction first. Number one, she said she had ulcerative colitis for 20 years. There's the sweet little curly hair, just darling. What did they give her? Steroids, non-steroidal anti-inflammatories, antibiotics. She was taking 5 Advil a day for 20 years. Okay? Now, bad gut or bad gut? Yeah, so we got her out of the stress state first, built her gut flora. She got off of all her medications, and she married me. So when I hear someone with ulcerative colitis, I thought, I got a soft part in my heart for that one there. Okay, so what is diverticulitis? Okay, now think of this. The intestinal tract is a muscular tube, and it has a beautiful wave that pushes food through. Now, if you compromise the blood supply or nerve supply to that, or mess with the intestinal flora, it weakens the wall. And if the wall pouches out, it's called a diverticulum. If it pouches in, it's called a polyp. So what are they from? You're talking altered nerve supply and blood supply to the intestinal tract. So what could cause that? Well, a fight or flight or stress state can cause it. Okay, toxic blood can cause it. Okay, direct trauma can cause it. Like you can damage, okay, the spinal cord ends right at the junction of the rib cage and low back. And if there's pressure on there, that's called cauda equina syndrome. That shuts blood supply down to the gut. So even minor traumas can alter that. Now, itis means inflammation. So if you have inflammation of the diverticulum, it's called diverticulitis. Okay? And if you just have this stuff that they found somewhere on CT scan or, something, they're going to call it a condition of, and that's an osis or diverticulosis. Okay? Now, it's interesting that countries that consume a lot of red meat and low fiber have a higher incidence of this. Countries that eat more plant products have a lower incidence of this. I know, you could say, wow, we've heard that 1,000 times before. Yeah, but this is just, think of this, dietary fiber, especially the insoluble stuff, the stuff that you can't break down, may reduce your risk of diverticulitis and inflammation of polyps in your intestinal tract by 40%. Brilliant. But think of this, itis means inflammation. If I scratch myself, that's red, right? That's inflammation. That's the body trying to heal. So if you hear diverticulitis, that means that area is inflamed and the body's doing everything it can to heal. So what's the medical approach for inflammation? You give it, that's right, an anti-inflammatory or a steroid. Oh, that'll wipe out the immune system too, and it'll stop the healing process. But you're right, there could be bacteria in the intestinal tract. Of course there is. Let's give an antibiotic, a poisonous mold. So we wipe out the normal gut flora, even though the antibiotic can actually bore holes in the intestinal tract as well. Now, if we do this for year after year after year to control the symptoms with chemicals that toxify the intestinal tract, weaken the immune system, and damage the intestinal tract. And then we can remove the intestinal tract because it is an offending organ. No! Am I kidding, Doc? It's true. Okay, it's mind-blowing. Okay, so these are all clues that there might be a problem. Fever, chills, vomiting, nausea, blood in the stools. I mean, you gotta look at the health of your body, because this is the end result of toxins. This is a great gal, and this is what a leaky gut looks like on x-ray. Now, 73, no medications. Her joints were starting to hurt. Why were they hurting? She has inflammation of the gut. Now, is her ability limited with a gut like this on her body? Because remember, we're only alive because we proteins to amino acids, fats to fatty acids, and carbohydrates to usable sugars. She's got an inflamed intestinal tract. That's 80% of her immune system. So if we heal the gut, does that help her immune system? Yes or yes? Yeah, but when you're looking at this, she's got a reverse curve in the neck. The one good thing she's got going for her is no medications. If you're a chiropractor and you want to fix her and she's taken 5 or 6 different drugs, I'll tell you right now, it's harder to get her better. If she's taking less drugs, it's easier to get her better because the drugs literally suppress symptoms. These are the causes of the diverticulosis. Nervous system problems, first you got to look at it. Antibiotics are insidious. They can be in bread, meat, or prescribed to you. GMOs, genetically modified organisms. Okay, they actually can damage your, because they're built to withstand glyphosate, which is this herbicide that's also a natural antibiotic and mineral chelator. Vaccinations, we're going to go into that a bit, and processed foods. Now, appendix. What does the appendix do? Do you realize that I had a patient whose doctor took out their appendix? Okay, and this guy had a horrible lifestyle. He's the son of one of our patients. Horrible lifestyle. He removed the appendix, and he asked the doctor who had just removed it what it did. And the doctor says, well, it was from back when we had tails. And I thought, it's a piece of the intestinal tract. How many animals poop through their tail? You know, I mean, I'm just thinking common sense. You know, I'm sure in zoology there's probably some pangolin somewhere that poops through its nose. You know, but I'm going, no, the intestinal tract. And if you want to know what the appendix actually does, Germany did most research on it. It's like a reservoir for bacteria. So if you develop diarrhea or anything, it's there to repopulate the system. If you lose the normal healthy flora, it's there to repopulate it. So you are actually designed to not walk around with a mask and gloves. You're designed to be a hunter-gatherer, picking up stuff, eating it, trying it, developing something, getting diarrhea, okay? And then the appendix rebuilds the flora. I mean, this is how your system is designed. So it turns out that if you remove the appendix, okay, because why would an appendix get damaged? Do you know that when they started to chlorinate water in the early 1900s, that there was a rash of appendixes bursting? Isn't that interesting? I know. It's because you're damaging the gut flora. So does that mean anytime you damage the normal bacteria or health of the intestinal tract, that you can negatively affect a bacteria reservoir? I know. You're thinking, talk slower, this is too stupid. I know. I'm trying to talk to everybody. So you look at this and you think, wait a second, everything that damages the normal flora can damage the appendix. Now it says if you remove the appendix, you increase your risk of colon cancer. Of course you do. Antibiotics kill the beneficial bacteria in your intestine, but the yeast start to grow because you got an ecosystem in there. Aboriginal cultures, 30,000 different species in there. Okay, standard Americans, you're talking a couple thousand. So we got to build this gut flora. If yeast, candida, viruses, funguses, bacteria, they're all normal in the intestinal tract. But if you do something to screw up the balance, okay, like you take an antibiotic or something else, you're going to have an overgrowth of one of those. Antibiotics, and this is interesting, taking azithromycin feeds bacteria that can poke holes in your gut, according to the New England Journal of Medicine. We look at antibiotics. Okay, you've got, like the bacteria in your gut, you've got 2 to 3 pounds of this. It produces bacteria. It's vital for your immune system. So anything that damages the bacteria damages you. You are a symbiote. You have, 70 trillion cells. You got 10 times that amount in bacteria. You got 10 times that amount in viruses. Without the viruses on your skin, in your eyes, in your intestinal tract, you would be dead. Without the bacteria in your eyes, on your skin, in your intestinal tract, you would be dead. This will not protect you from viruses, funguses, and bacteria in your friggin' eyes, or your hair, or on this. So as soon as I touch this, I have just infected myself. Yeah, just make sure you don't touch your eyes. Yeah, really. How would you like to do this? How many times have you picked up a couch and your nose started to itch? Glad it wasn't just me. Artificial sweeteners, this is a great idea. Let's bind some chlorine to a sugar molecule, so this way you'll taste it, but your body will recognize it as poison it and flush it out of your system. How could that be harmful? What could possibly go wrong? Okay, it destroys the gut bacteria by 50%. Affects eyes, nose, joint, head, lungs, skins. Glyphosates. This is sprayed in every genetically modified organism. It's sprayed on our grains. Why? Because grains give up their seed when they're about to die, so you can increase production around 20%, but it will damage the human. The study finds glyphosates in breast milk of moms. Wait a second, this stuff damages the gut flora, 80% of the immune system. And the moms are soaked in this stuff. It's in her breast milk, and what kind of creatures suck on the breast? They're called babies, okay? And they're taking something that destroys their gut flora. Is that good or bad? Okay, because you know there's a pediatrician out there going, I don't know. Glyphosates have been found in America's urine and drinking water. Yeah, if it's in the drinking water, it's going to come out. I know. Think of how crazy this is. And this has been, exposed got a huge number of court cases that it's also carcinogenic. And I love the Monsanto spokesperson. Number of peer-reviewed studies have said that it's safe. It's actually GR grass. Okay, it's generally recognized as safe, but there's no actual studies on it beyond 90 days. However, the International Assessment of Agricultural Knowledge says the genetically engineered foods have nothing to offer, and the goals are reducing hunger, poverty, nutrition, health, or rural livelihoods, facilitating social environmental sustainability. It doesn't work. So all the promises doesn't work. The U.S. Department of Agriculture and the EPA warn people about glyphosate's grains that it can damage your intestinal tract and normal flora. These are two of our patients. Astro Guy on the one, he's going to be an astrophysicist, and Awesome Dude on the next. Astro Guy actually came up with a name for both of these, but I want to show you a normal gut and an abnormal gut, because that normal gut on the left, you're going to see this little tiny like half moon. That's called a Magenblas. Okay, and I was kind of depressed to know Magenblas just meant gas bubble in German. Okay, because it's the gas bubble in the stomach, and I found that from one of our German patients. I thought, yes, that's a Magenblas. Oh yeah, it just means gas bubble. But you can see on the person on the right how it's huge. That's because of physical, chemical, or emotional stress. Okay, and we're looking at vaccines actually damage that, but also antibiotics, like say there's a history of ear infections. But luckily that gut will be normal in about 60 days. Okay, you just got to fix the problem. Vaccines are forming a new inflammatory bowel disease. We know that. Why? Because a vaccine triggers an inflammatory response. Don't worry, I'm sure the COVID vaccine will just be fine. It's tested on like 30 people for about a month. You're going to be fine. Yeah, you first. Okay, so you got an immune system response that is a Th1 response, which is both humoral and cellular, and this is long-term. This is how you're exposed to stuff. If you get a splinter or an acute one, that's the Th2 response. Well, the vaccines are triggering a Th2 response. The live vaccines can do the humoral and cellular response, but the majority of them are triggering an inflammatory response. So what are we seeing in humans? Massive rise in inflammatory diseases. Okay, so we're talking gut disorders, brain disorders, pancreas disorders, gastrointestinal symptoms in autism spectrum disorder. Now, knowing that it's really kind of tough, like if you look at New Jersey, they have 1 in 20 boys now, okay? And granted, they're looking at 8-year-old kids, so knowing that autism starts at around 4, okay, but then you got Asperger's that happens when you're a teenager, so there's a lot of different variables, like when do you stop the cutoff to start counting for autistic? But if you know the majority of them start around 4 years old, and then, it happens up, but they just decided to pick 8 years old, okay? So, just to gather data. The results indicate a greater prevalence of gastrointestinal symptoms among children with autism spectrum disorder. Yeah, of course there is. Why? Because, well, the glyphosates are in the milk. Could that be a contributing factor? Maybe. Could the vaccines be a contributing factor? Maybe. Should we treat kids like cats and, I don't know, individualize their therapies? No, I know, I was just kidding. Okay, so ketogenic diet has diverse neurologic disorders. And you're looking at epilepsy, headaches, I mean, all this stuff, just changing the diet, changing the nutrients in the system. When we're looking at gluten and casein free, do you know that I posted this once and a person said, there's no evidence to say that gluten and casein reduction will help. Well, there actually is. Okay, it's called reading. It's really a habit I picked up when I was a kid. So it's called nutritional science, and and you could just look at it. I mean, before all of this craziness, we were building a lab in Tijuana so I can get some fecal transplant samples so we can build our own material to help with the gut flora, which is fantastic for neurologic diseases, fantastic. But with the shutdown, I had to shut down a bunch of stuff. The border's still open, but we had to reduce our staff, and that's horrible. So this is how you heal the diverticulitis. First, got to get them out of the stress state. Look at the physical, chemical, and emotional stressors that's there. Healthy fats, organic butter, if you eat animal products, coconut oil, olive oil, walnut, it's got to be organic oils. None of the synthetic oils, the cottonseed, canola oil, none of that stuff. It's toxic. Colonics are a good idea. Okay, and this is colon hydrotherapy, where they put a tube up your butt, fill your intestinal tract. Yeah, it's not comfortable, okay? And then they drain it, and they do this over a series of a few. Your intestinal tract, you should be in a healthy state to do it, but you should also be on a juice fast before you do it. It's incredible. Oral chelation is fantastic. You can do this every time you pick cilantro to go in your smoothie, or you get that green smoothie, or you get some plants in there. That's a chelating agent. Let's say you take some chlorella, spirulina. That's going to be a chelating, oral chelation agent. For serious stuff, that's what we got the clinic in Tijuana for. We'll do EDTA. Amazing. I mean, this has been around, since the 30s. And this will bind to toxins. The problem, when we do the IV chelation, it only costs $120, but it takes 4 hours. Now, this is going to bind to toxic heavy metals and get it out, but it also binds to good metals. So if you're going to do this, you got to put the good metals back in. So it takes 4 hours to draw the stuff out. Then you got to wait a couple hours. Then you got another half hour to an hour to put stuff back. So it's a long process. It's pretty cheap. This spirulina and chlorella, absolutely fantastic. And one of the tricks, because it does taste like pond scum. Has anyone tried it? You know why it tastes like pond scum? Because it is. There you go. Thank you, my brother. Yeah, but kids won't take it. But when we're looking at all the vaccine damaged kids, try the little tablets. Okay, because if they're able to swallow little tiny, because they're little microscopic ones, Wujicarella is a good brand. This cleanse is disgusting, but it works. Has anyone done the VE Irons cleanse? 7 days of supplements 7 times a day. It's putrid, but it works great. You can go to the 3 to 7 day cleanse at veirons.com. Oh, this is a good one. For years, and we were talking about science earlier, how a lot of science is based on urban legend and not real data. And so they used to think that if you have holes in your, or outpouches in the intestinal tract, that you shouldn't eat seeds or popcorn or corn, that it would get stuck in there and cause inflammation. No one really looked at it. No one really did a study. They just thought, yeah, I don't know, makes sense to me. Okay, so then they did a study, 47,000 people published in the Journal of the American Medical Association. It turns out that you give nuts and seeds to these people, they have a lower incidence of it. Think of it. I mean, the best fiber foods around, rice and beans. That's a complete protein. Beans, greatest fiber food out there. So rice, beans, plant-based, is that good or good? If someone's in severe challenge, you get them out of the stress state. You stabilize their pelvis. You look at the physical, chemical, emotional stressors. This is a great way to build back up. Now make sure that all of this stuff is organic, because we want to get some healthy gut bacteria in there as well. Carrot juice, carrot and lettuce juice, grape juice, and this is just to get that. And when you're juicing something, you're getting soluble fibers that can actually get in the bloodstream and start to clean the arteries. After your body can tolerate the liquid, then you can start tolerating more solid food. This might take, well, it says 6 to 8 weeks here, but really it usually is around 3 to 4 weeks. And this is with, and I'm talking very, very severe cases. And I like this from the CDC. Modifiable risk factors, and this is for most diseases, but also for brain dementia and dementia-like symptoms. Increasing physical activity, having a diet rich in fruits, vegetables, maintaining social engagement, and participating in intellectually stimulating activities is good. What's bad for your brain? Medications, nutritional deficiencies, infections, poisoning, brain tumors, anoxia or hypoxia. So it turns out that if you want a healthy brain function, you can't do antisocial distancing and you can't be on a house arrest. So, sarcasm? Okay. Health freedom. Is this important to you? I stole this point 1 from this little document that we don't look at anymore. Okay, Declaration of Independence. We hold these truths to be self-evident. How would you like to sign up for this? Okay, all we got to do is have a politician that can read and speak. We hold these truths to be self-evident that all men are created equal. Anyone got a problem with that? Problem with that? Okay. That they are endowed by their Creator with certain unalienable rights. Among these, life, liberty, and the pursuit of happiness. Except for you. No, that wouldn't be fair, would it? No. Does this mean that everybody on our planet should sign up for the pursuit of life, liberty, and the pursuit of happiness? Would you want to restrict your neighbor from having this? Or do you think that your neighbor should have this? People that you don't like should have this. Okay, that would make the world better. Yes? Okay. Now, that to secure these rights, what rights? Life, liberty, and pursuit of happiness? Governments are instituted among men, deriving their just powers from the consent of the governed. Do you consent to forced medical procedures without your informed consent? No, then the government is invalid, and we do not follow it. The other points are mine. Vaccinations will stop until long-term independent research is done. And now I know the vaccine research on this COVID thing is being done by the people that manufacture it. And I know you're thinking that it'd be fine to have Boeing investigate their crashes as well. Sure. That's insane. No, that's why we have independent investigation of airplane crashes. Healthcare research should be independent. That would make sense. Pharmaceutical industry, financially and morally responsible for their products, which luckily, since this is an emergency, it doesn't matter. There is no financial responsibility for this. So if you develop anything from the shot, you can't sue anybody. Not even, I don't think, vaccine court even. All humans will be able to choose any healthcare procedures. None will be forced on them. I think it's okay. Medical Freedom Pact. This is an organization I think Mr. Kennedy is in there. I know Del Bigtree's in there. I mean, this is a way that we can change our political system to get health back. How long will this be not censored? I have no idea. We are keeping it on Extreme Health Academy and can still get on there for a couple of weeks. We're trying to change and get another site where they are wiping out private sites as well. And this is to the extreme. And they said, look, you just put it on your private site. No one can touch that. That's not true anymore. BitChute, that's still working good. They wiped out a bunch of ours on Vimeo, YouTube. I think we're at about 10 censored videos now, and Bergman Chiropractic. So look at this. And if you see something, like I have posted so many things on Rashid Bashar, and I like him. I think some of his stuff is a little too theatrical, but his information is really accurate and good. And then I'll go, I got to show you this. Oh, it's gone. And if you've tried to post anything from Natural News, it says, no, this is scam or spam, and you can't do it. And, you know, so the censorship is beyond anything I've ever seen. Now, this is for, again, the censors. Okay, I started with the censors. We're going to close with it. Reference, 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 reference. Okay, if you have a problem with my message, okay. Gosh, it would be, from a guy's perspective, is it harder to calm down and think of something politically correct? Or is it harder to just pick up a sword and go into battle? Doesn't that sound easy? It does. You got life and death. It's fine. It's simple. You got an opponent. You know what to do. Wonderful. The stuff we're going through is hard. It really is hard because we're working with ignorance and a belief system that's not based in anything even close to science. And then they're taught that their belief is more important than yours. And I've never seen it in any country or anything. Everybody in our family, every opinion was valued. It was. Next week, we're going to talk about ulcerative colitis. But when you feel down, when you feel overwhelmed, realize that it's impossible to have a one-sided world. Okay? As much evil and stuff and things that you're frustrated with, realize that the antithesis is out there. We just got to look for it. Okay? And if you can't find it, go to where Lincoln did. He went down on his knees. Thank you very much.